Hello and welcome to the Vineyard Haven Library. This is part two of the two-part series, Tick Ecology and Tick-Borne Diseases with Leah Hamner and Patrick Roden-Reynolds. In today's presentation, Leah will discuss tick-borne diseases found on Martha's Vineyard, including the new kid on the block, alpha-gal syndrome or red meat allergy. Leah Hamner is an epidemiologist for the Inter-Island Public Health Excellence Collaborative. She focuses on infectious diseases and of public health significance and promotes data-informed decision-making to support healthier communities. Patrick Roden-Reynolds is a public health biologist for the Inter-Island Public Health Excellence Collaborative and director of the Martha's Vineyard Tick Program. His work focuses on education and surveillance of vector-borne diseases and their vector populations. Over to you, Leah and Patrick.
Thank you. So good afternoon, everyone, and thank you for joining us. Again, my name is Leah Hamner, and I'm an epidemiologist with the Inter-Island Public Health Excellence Collaborative, as well as Barnstable County, Cape Cod. And today my presentation is titled Ticks, Pathogens, Allergies, Oh My. There is a lot to cover in today's presentation. We are going to be moving rather fast, but this will be recorded and available on our YouTube channel afterwards. We are going to be talking about trends and tips for Martha's Vineyard specifically. So without further ado, let's get started. So we're going to be talking about the ticks, the pathogens, and the allergy. But throughout, we're going to be talking about what you can do to keep yourself safe. That is a very important message to today's presentation. To kick us off, I'm going to give you a horrific photo of what was found in my own backyard. I live in Chilmark, and Patrick, the tick biologist and director of Martha's Vineyard Tick Program, who does residential home surveys, he came to my house, and in 1 hour in May, he was able to collect 47 ticks in my yard. And this is an absolutely phenomenal photo of like what our tick ecology looks like. So first things first is there's two species of ticks on this lint roller. The first are deer ticks. So these very small ones, those are actually teenagers. They're not even the smallest ones. Those are nymph deer ticks. Then these bigger ones are the adult deer ticks. Very small. This is a fine point tweezer. And these teenagers are smaller than a fine point tweezer. They're very small ticks. Now these, in increasing numbers, they've almost overtaken the deer ticks. These are lone star ticks. And some of them have white dots. Those are the adult females, but the adult males and the teenagers, those don't have white dots. So just so you know, only the adult females have white dots. And Patrick also grouped them by where he found them in my yard. So these ticks were all found on the edge of my yard, where the lawn stopped and the shrubs began. So the tall grass, the small shrubbery, that's peak tick zone, the edge of your lawn, because that's where a lot of animals also are. Ticks do not move too much laterally in their environment. They usually are moved around their environment by what they bite, by animals. And so where you find animal activity, you can find tick activity on Martha's Vineyard. These ticks were found in my lawn, in the short cropped lawn. And so this is a pretty good graphic representation of also how your own home management and lawn management can reduce, but not altogether remove ticks from your yard, but does help. And so that's an important point to drive home to. These are also lone star ticks. They just didn't get moved into the grouping. So we want to talk about before the bite, what to do and how to recognize the ticks and when to be aware of their presence. So here, fast forward, that was May. So that actually was May 31st. Memorial Day weekend is kind of peak tick activity season. Fast forward further into the summer, this is taken in my yard again. Patrick came back by again, and this is mid to late July. And there's fewer ticks, not 47, but we're still talking 18 ticks in my yard. and they're smaller. So these are the nymph, the teenage deer ticks, and these are actually larval Lone Star ticks. And so the ticks get smaller and harder to find. And in July, think of what you're wearing and you're doing in July. I am wearing shorts and flip-flops often, but ever since I took this job, I'm not. I'm wearing my repellent. I'm wearing my permethrin treated clothing. I am protecting myself against ticks because they need to get to your skin to bite you. If you're interested in getting this kind of information on your own yard, quick plug that you can contact Patrick Roden Reynolds at biologist@dukescounty.org, and he will come visit your yard and check it out and talk about what you can be doing to try and mitigate ticks in your yard, how to live a little safer, and what you can be doing. And so another thing that I want to tell you about right now, while it's in front of you, is these are two tools of the trade and should be part of your tick kit. You live in tick country if you live on Martha's Vineyard or Cape Cod or Nantucket. And having fine point tweezers, or really any tweezers, and a lint roller are two excellent, totally portable, cheap things to have to get ticks off of you as soon as possible. The lint rollers are fabulous to be able to roll unembedded tick right off of you and capture it. And then of course, tweezers are for removing ticks that have bitten. So two things that are well worth investing in. I have them in my car, I have them in my bag, I have them in my husband's car. We roll deep in lint rollers. They're really helpful. I also want to take a moment to talk about tick habitat. It's actually probably easier to tell you where we don't find ticks than to tell you everywhere that we do find ticks. So places where we don't find ticks. We don't find ticks on asphalt and roads and bare dirt and wood chips and mulch and gravel. And that's kind of it. This is a picture of a place ticks love to be. Ticks love to be in leaf litter. And that's because ticks are very sensitive to humidity. They really need humidity to survive, and they dry out and die if they're in direct sunlight and not in a lot of humidity. And so in leaves, they can actually go down into the leaves and create little microclimates of humidity. And so they really do like leaves. They also love tall grasses and shrubs. This is a familiar sight. So you might see them hanging off of these long grasses. You might find them on these shrubs. You're not going to find them down here on the cobbles or on the beaches. But as you come up from the cobbles and the beaches to the sand dunes, you might start finding them trying to find the next thing to bite. Here in the middle of the trail, that's safe, but brushing up against the sides is where you risk picking up a tick. Here's another picture of a common ecosystem we have on Martha's Vineyard. And ticks love it here too. And really, it is also, again, as I mentioned earlier, where animals are. If the animals are going through your property or through the woods, then they might be carrying ticks, and the ticks drop off of those animals, grow up, and then look for a new meal. And so there could be ticks in these grasses, there could be ticks on these shrubs, and these grasses out here, tick habitat. Here's more tick habitat. So staying again in the middle of these trails will keep you away from the edges where ticks like to be. Ticks do not like to be on bare dirt and bare ground, but they do love to be on vegetation. And if animals are around, there's probably ticks. Here's a surprising place. You probably didn't know that you can find ticks on Martha's Vineyard. And I bet when I start explaining this, it'll start to make a lot of sense. So rock walls, that doesn't seem like a great place for ticks, but think about the animals. Think about the animals that ticks bite. If you were a white-footed mouse and you needed to make a nest and you needed to find shelter to make a nest, doesn't this little pocket seem like a perfect place to make a home? And these little places and these little nooks and crannies, those are perfect places for animals, for mice to make homes, and they're being bitten by deer ticks often. And so that's where when the deer ticks feed, fall off, and we can actually find some deer ticks around rock walls. And we have miles and miles and miles of rock walls. This is part of our agrarian heritage here on Martha's Vineyard. And so then they might climb up onto these grasses nearby, but we're not going to find a huge amount of them in the lawn. It's not a really nice humid place, but we are finding that lone stars are a little bit more resilient to temperature and less humidity. And so we are finding more lone star ticks in the lawn, though they do not prefer to be there. They definitely prefer to be in a more humid place. This is a picture of my yard. And so to show you exactly what I mean, this is the kind of habitat that Patrick found all of those, most of those, I think 44 of those 47 ticks were found in this kind of place. Whereas there were 4 ticks that were found in the lawn. So this is the kind of peak place that they love to be. And so this is really important to know for your animals, for your dog, for your cat. This is the kind of place where they risk getting bitten. Your kids who play in the woods, this is the kind of place where they can pick up ticks right around your house. So when we're talking ticks, we have 3 different human biting tick species on Martha's Vineyard. There's actually more tick species on Martha's Vineyard, they just don't bite humans. So these are the main concerns. So deer ticks, here we have the babies, the larvae, tiny, tiny, tiny things. This is a blown up picture for this presentation, but if you see us out in the community, we have this real placard to show you exactly how small they are. So here are the babies, the larvae, here are the teenagers, the nymphs, and here are the adults. And so they take 1 blood meal to grow up to the next stage. So they actually only feed twice in their lifetime. And that is where they pick up diseases, biting animals that have infections. So they're not born with diseases. They don't hatch from eggs with diseases. Now, lone stars, again, babies, larvae, teenagers or nymphs, and then the adults. And here you can clearly see that the females have the white dot, the males do not. They're called lone stars purely because they have a white dot, not because they're from Texas, just because they have a white dot. And then the dog tick adults, here we're only showing you adults because the larvae and the nymphs do not tend to bite humans. Really, it's the adults that bite humans. And so we're featuring the human biting ticks. And these are the classic Martha's Vineyard tick. They've been here a long time. Zoomed in, this is what they look like. This is what a good microscope will get you to be able to see what they actually look like. So here's a deer tick, or also called a black-legged tick. Here is a dog tick, and here is a lone star tick, adult female. This is also an adult female. And this is what it looks like when they start feeding. And we want you to catch them here. We don't want you to catch them here or any later. This is where we start getting in the risk for disease transmission. But if you catch them here, right when they first bite, or better yet, before they even bite, that significantly reduces your risk of tick-borne disease. So here, they have really hard exoskeletons. They're hard to squish, and actually really don't recommend squishing them. Instead, put them in a jar of alcohol. The alcohol is just because that has no surface tension, and so they sink and they drown eventually. But or in tape, that's an easy solution to have in your car. But as they feed on a blood meal, they start swelling up into little balloons. They go kind of raisin to grape, and the longer they've been on you and the more rotund and gray they are, they suggest the longer that they've been feeding. And this is concerning for disease. This is a graphic we talked about in our last presentation. And so for those of you that weren't with us, I am going to explain it again because this is an absolutely great graphic that Patrick created for us based on real information he's collected by doing tick surveys on Martha's Vineyard over the course of the years. So lots of information. Let's take it piece by piece. Along the top are the months of the year, January, February, all the way to December. Along the side are the 3 different types of ticks. So we've got the first is the deer tick, then the dog tick, then the lone star tick. And then we have for each tick, there's life stages. and they're active at different times. And so let's start with the babies. Blue are the larvae. So blue are the larval stages that bite humans. In red are the teenagers. Those are the nymphs. And in yellow are the adults. And so with that information, here's one quick takeaway. Is there any time of the year where ticks are not active on Martha's Vineyard? The answer is no. Unfortunately, deer ticks, adult deer ticks, will be active in questing and looking for a blood meal if it is above 40 degrees. So maybe if it's below 40 degrees, they won't be actively looking for a blood meal, but they actually produce glycerin that acts as an antifreeze. They don't die because it's really cold out. That's why we see cases of very well-established deer tick population in places like Minnesota and Wisconsin that have very, very cold winters. But when it warms up above 40 degrees, you can find a deer tick. And so tick bite risk is year round on Martha's Vineyard and Cape Cod and Nantucket. It's year round. However, most of the risk is in the spring to fall months. That's when the most life stages are actively looking to bite something. And that is also, and I'm going to show you really what the summertime looks like in terms of human disease. So those are the main takeaways on this graphic. Here we're in October. A lot of tick activity is phasing out. So the teenage deer ticks are phasing out, the baby deer ticks are phasing out, the dog ticks are phasing out, and the lone stars are starting to phase out, but they're still, we're going to talk about these next. These are baby lone stars, and they behave differently than deer ticks in that they cluster, which is very not great, not a great development. And so they will literally dogpile on top of each other at the end of a blade of grass, and they actually create like this living mass of lone star larval ticks, and they're waiting for something to brush by it, and then they all get on, and then they all try to bite. And so this is we call it a tick bomb. It's probably the best way to refer to it. And we're talking 100 to 500 larval baby lone star ticks. And they're most active in August to October. So unfortunately, we're still in the risk season, but Patrick has found them as early as May emerging. But really, it was really impressive when Patrick and I were working at the ag fair in August, and we had our booth and we were talking to people about ticks. About 50 people came up to us and showed us their ankles that look like this. And so this is what happens when those 50, 100, 200 ticks bite. Larval bites are pretty miserable. They can last for weeks. They itch. It's not that there's a tick still in there. The baby larval ticks are actually pretty fragile. If you scratch that itch, you're actually probably going to get that tick off just by your fingernails, unlike an adult or a teenager tick where you need to get a tweezer to get it out. However, with the larval ticks, they're pretty fragile. And so scratching it off is actually pretty effective, though you should definitely scratch with clean hands, and you should be also washing any wound very thoroughly after. These bites can last for weeks. People are pretty miserable with them. We do see folks confused with chiggers or oak mites. Please do go back and watch Patrick's presentation. He talks all about this, if this is something that you want to learn more about. And ticks really are found in the first 3 feet from the ground. They're not found higher than that. And so if there's bites on the lower extremities, that is a pretty clear sign that it's a tick bite. However, ticks are evolutionarily designed to climb. They can climb up an animal, they can climb up a human, and so they can bite higher. But certainly ankle bites that look like this is suggestive of Lone Star tick bombs. And with the babies, you are the first thing they've ever bitten. You're the first thing that they've ever bitten. And so they're not going to give you a disease. However, they can trigger an allergy. And we'll get to that point. So there were a lot of really miserable people with Lone Star tick bite bombs this summer and this fall. So just wanted to plug, it really is about itch management. There's no like golden solution to really make it go away. Really, we're talking about oral antihistamines like Benadryl, topical antihistamines, and maybe some topical steroids. We're talking about like hydrocortisone, which you can buy at your pharmacist. But talk to your pharmacist. Talk to your pharmacist about what you're experiencing, and they can help you. And if you want something stronger, you need to talk to your doctor. So your doctor can potentially prescribe oral or topical steroids. And then there's also permethrin cream, which is a treatment used on lice and scabies. And scabies actually burrows into the skin. And so permethrin cream kills any insect on your skin. It is a single application. You only apply it once to kill the insects, and then the itch might remain. So consult your doctor about whether any of these things are appropriate for you. This is a horrific photo, and this is not our island. This is actually the island off of Nantucket. This is Tuckernuck, but this is our colleague, Dr. Sam Telford, who's done an immense amount of tick research on both Martha's Vineyard, Nantucket, and throughout Massachusetts. This is a picture of how small these tick bombs look on a real leg. They look like dirt smudges, and then they start crawling. And it can be pretty horrific to experience. On this leg alone, on Dr. Sam Telford's leg, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12 maybe Lone Star tick bomb clusters. There's probably like 8,000 baby ticks on his leg. If that were me and I didn't know better, I would be ripping my pants off. If that were me, and I would be lighting it on fire. Like, what is this? Dr. Sam Telford stops and takes a photo. He's not panicking. He's not running around. He stops and takes a photo. And that is because he is confident that he is safe. These pants are permethrin treated. These shoes are permethrin treated. These socks are permethrin treated. Permethrin treated clothing and gear kills ticks. And so all of these ticks were exposed to permethrin and then die. They actually will fall off one by one within about a minute, 2 minutes, and then they'll die. And so this is our number one prevention tip before we even get to diseases. Stop the bite. If you get tick bites and you want them to stop, permethrin treated clothing. I have not gotten a single tick bite since wearing permethrin treated clothing. Patrick, I know that you're joining us today as well. I was wondering if you could attest to your record with permethrin treated clothing.
Yes, I've been here 3 years, 3 tick seasons, and I have 0 bites that I know of, but no known tick bites, and I've never really seen a tick on my skin, and I'm very diligent with my clothing.
And Patrick literally collects ticks for a living. He's in tick habitat all the time.
At least a few thousand each summer.
Yep. So a couple options for you to do this. If you want to do it at home, you can buy the spray. You can actually do this at home yourself. That lasts 6 washings or 6 weeks. It's really great for shoes, especially also for field equipment. So if you find yourself out in the woods and you're setting stuff down out in the woods and you don't want to pick up ticks and bring them home, you can treat it with permethrin. And spot treatment. You can also do your full outfit. You can totally do your full outfit. I did my husband's 3 pairs of pants, 2 pairs of shoes with 1 bottle of permethrin. So the different option, and the reason that we're kind of leading up to this is really, this is my preferred method. This is Patrick's preferred method. And this is Sam Telford's preferred method, is sending in your stuff to get professionally treated, because the difference is 70 washings versus 6. And so if you do this, if you do the 6 washings, just remember to set a calendar reminder. to make sure that you're not going unprotected because you forgot to retreat it. But for 70 washings, that's a pretty good bang for your buck. And for some pieces of clothing of mine, that's going to be the lifetime of my clothing. And so Insect Shield is been a great partner for us. We get no kickbacks, no financial incentives at all, but they've just been helpful. And they've given us a 15% discount code for anyone who wants to use it. You don't have to be an islander. This is just what they created for us, to be able to either mail your own clothing in, which is my preferred method. I send in my pants, I send in some leggings, and then I have a base layer underneath anything so that if a tick gets crawling up my leg, it's going to get permethrin treated and zapped. And also buying new pre-treated stuff also is an option, and that's really great for socks. It's more, if you can run the numbers on yourself about what's the most economical way to do it, but really the technology is patented. It's the same permethrin. The technology is why it's so much longer is the technology to affix the permethrin to the clothing. So that's what the technology is. So that's our number one prevention message today, but we've got a couple more. But before we move on, I'm going to drive the point home. One of these socks was permethrin treated, and one of them was just an average sock, not treated. And I bet you can tell which one's which. So Lone Star larvae are tiny, and they can actually fit sometimes through the weave of your sock, and they can bite you through your sock. This foot had no bites because it was a permethrin treated sock, and it's like hot lava to the ticks. It is safe for us to wear. The EPA has studied it for almost 30 years at this point. It has very poor absorption through the skin, and it is toxic to ticks. And so it's like hot lava. It slows them down, and then they fall off and die. It's great. If you're doing permethrin, you should still be doing smart fashion, but also smart fashion can be done without permethrin. Basically, you want to prevent those ticks from getting to your skin. So shorts and flip-flops is a buffet for a tick. Now, of course, in the summertime, it's hot. Wearing a lot of layers is tough. We acknowledge that. But potentially wearing like permethrin treated layer through the dune as you're walking to the beach and then taking it off when you're at the beach. Protecting yourself in tick habitat is doable. Better than this is to have like maybe some shoes and some socks, barrier method alone. But as I showed you, some of the socks untreated, you might still get bit through them. So permethrin treated, knowing that ticks are in the first 3 feet from the ground, working your way up in terms of your garments. Even best is to actually wear a full outfit and just prevent those ticks from getting to your skin. Tucking into your socks, your pants into your socks, your shirt into your pants, prevent them from getting to your skin. And for the gardeners on the call, this is also important to be able to protect your sleeves and your arms as you're reaching into plant matter. You might be picking up ticks on your arms. So think about that too and what you're wearing. Prevention tip number 3, if you can't wear clothing, wear repellent. So there's effective repellents that basically ticks just don't like to be around, so they don't want to get on you. It doesn't kill them, but picaridin, DEET, IR353, I'm not even going to try to pronounce that, oil of lemon, you can plug into a tool called the Find the Right Repellent for You tool from EPA, and you can plug in how much time you need protection, what you need protection against, and like what products you're interested in to get an output of, oh, these are some repellents I might try. So that's a tool. And then we talked about lint rollers and tape and tweezers, but I'm going to reiterate it. This is super cheap and a go-to tick kit on Martha's Vineyard, Cape Cod, and the islands. And so have a lint roller in your bag, have a lint roller in your car. You be surprised how often you find it. And really the lint roller is the best solution against a Lone Star tick bomb. This is a lint roller tape that these Lone Star ticks are on. It is the fastest way to get them off of you. picking them off individually with tweezers is a losing battle. Just roll them off. And then tweezers are great for when they have bitten. Hopefully you catch them before, but of course, get them off. Point is, get them off you as soon as possible. Another tip you can do is you can actually throw your clothing in the dryer. We kind of talked about this already, that ticks need humidity to survive. And so if they dry out, they will die. That's like one of the things that they're sensitive to. And so if you have been outdoors and you're worried about a clinger, throw your clothing in the dryer, 15 minutes, 20 minutes on high heat, it'll kill them dead. My one caveat is that you live probably in poison ivy country too. There's a lot of poison ivy on Martha's Vineyard. You don't want to spread poison ivy oil all over your dryer. So if that is a risk, like you've been in poison ivy, go ahead and just leave your clothes outside and then leave them there for a couple hours and then come back for them. And any ticks that are on there will have fallen off. But if you have a clinger on that makes it into your house, I learned this actually from Patrick's presentation last time, you have pretty low humidity in your own home. And so a tick is going to die if it's in your home for after a couple of days because the humidity, they dry out. And the last prevention tip before we move on to the next phase of the presentation is daily tick checks, daily. And this is a habit. It's hard to develop if you don't have it, but you can do it. I've done it. And one of the ways that I trigger myself to do this is I have a plastic mirror, handheld mirror in my shower. I see it. That tells me I need to do a tick check. I grab it, takes me 30 seconds to look at the places I can't see on my own to see that I don't have a tick. And that way I practice my daily tick checks all the time, because really ticks are designed evolutionarily to be sneaky. They're designed to be able to creep up and take a blood meal, not be noticed, and fall off of you. And they love to bite behind the knees, between the toes, in the groin, on the belt line. I've definitely helped a friend find one in their belly button before, in their armpits, and they absolutely can crawl up to the neckline, to the hairline. So be cognizant and practice your tick checks and get them off of you as soon as possible. That is absolutely critical to our next phase of our discussion, which is talking about the diseases. So at this point in time, we are going to move on to talking about once you've been bitten and potentially have become infected with an infectious disease. This is actually a zoomed in photo of Lyme disease, just straight Lyme disease in culture. This is what it looks like, little spirochetes. And so that is kind of just so you know what you're dealing with. So I mentioned this earlier, and I'm going to mention it again. Ticks are not born with an infectious disease, and born is kind of a loose term because they start as eggs and then they hatch. But as eggs, they don't have infectious diseases. And as baby larvae, they don't have infectious diseases. They have to bite an animal with an infectious disease. And so Martha's Vineyard has several animals that can be infected with infectious diseases. We have white-footed mice, we have skunks, we have raccoons. Patrick, I can't think of any other ones. Deer. Oh, sorry, forgot about deer. Deer certainly can be infected with infectious diseases. Can you think of any other animals that sustain disease transmission in Martha's Vineyard, Patrick?
Yeah, it's typically the small mammals that are the disease reservoirs. So voles will be a big one, and shrews and Lyme disease.
Thank you. So lots of animals kind of contribute to this disease cycle. So the ticks bite the animals. They become infected. They don't usually bite something and then bite something else, but I guess they can if they haven't had a full blood meal. But usually what they do is they take their full blood meal on the animal, and then they grow up to the next life stage, the teenage stage, nymphal tick. And at that point, they've been infected. And if they bite you, if they're on you long enough, they can infect you. If they don't bite you here, maybe they go about their business and they bite something else. They could bite something with more pathogens. They can, and I'll show you that in a minute. And then the adult might bite you and then you get infected, or the adult bites animals and infects animals. And then the tick falls off and has eggs and the cycle repeats. This is a very nice summary slide with a lot of information in it. So we're going to spend some time here. This, again, these slides are going to be available to you. You can feel free to print this out. But this is a summary of tick-borne disease in Martha's Vineyard. Unfortunately, so this is looking at from most common to least. So 1 is most common, 8 is rarest. And this is 15 years of information put together. So big picture, this is what our disease profile looks like over the last 15 years. So big picture, Lyme disease is still king, babesiosis is second, and anaplasmosis is third. This order, 1, 2, and 3, is the same order you're going to see anywhere in Massachusetts. We just have more of it than Massachusetts, but that same ranking of most common to least common is what you're going to find in the rest of Massachusetts. Where Martha's Vineyard becomes special is that our number 4 is tularemia. And we have endemic, as in it is in our environment, it's in our ecosystem, tularemia. That's not everyone else's experience. So that's our 4th most common disease. It's also not just a tick-borne disease, but we'll get into kind of how these things are transmitted in a second. Let's just stay in this first column for a second longer. 5th is Rocky Mountain spotted fever. 6th is ehrlichiosis. 7th is this disease called Borrelia miyamotoi, or hard tick relapsing fever. And the 8th is Powassan virus. So 8 infectious diseases on Martha's Vineyard. I want to skip over the pathogen type and actually go next to the types of ticks that transmit these diseases. And what I want you to quickly be able to see is the type of tick matters. Not all ticks can transmit the same diseases. Again, pretty complicated information, hard to tease apart. However, what I quickly want you to see is our big 3 are deer tick diseases. Deer ticks are still a huge problem in our community for the diseases that they transmit. They also transmit Borrelia miyamotoi and Powassan. These are exceedingly rare diseases, though we've had them on Martha's Vineyard in 15 years. There's been 1 case of each. Then we have our lone star tick diseases. Tularemia, let's come back to that because there's more to know about that. Ehrlichiosis is a lone star tick disease, and we are seeing increasing numbers of ehrlichiosis cases with our increasing numbers of lone star ticks on Martha's Vineyard. That population, if you've been on Martha's Vineyard for the last 3 years, you've seen a dramatic change in the amount of lone star ticks on Martha's Vineyard. And then dog ticks, the big fat ones, transmit Rocky Mountain spotted fever. Now back to tularemia because it's special. Tularemia is actually not just a tick transmitted disease. It's also called rabbit fever. It also can infect and contaminate water. It can be ingested. We have had several outbreaks on Martha's Vineyard dating back to the early 2000s where landscapers blowing and mowing blew up tularemia and inhaled it. And so that infected them. But it also can be caused by ticks, and tularemia can be caused by both lone star and dog tick bites. And then the other thing lone stars have, and only lone stars on Martha's Vineyard can do, is alpha-gal syndrome, which is an allergy. And we're going to talk about that in phase 3 of the conversation today. Back to this column, I want to highlight for you that most of our infectious diseases are bacterial infections. So Lyme disease, anaplasmosis, tularemia, Rocky Mountain spotted fever, ehrlichiosis, and Borrelia miyamotoi, those are all bacterial infections, and they're treated with antibiotics. Most of them are treatable with doxycycline. Some of them need a little bit more of a push than just doxycycline. If you're allergic to doxycycline, there are alternatives for some of these diseases. The one caveat is our second most common infectious disease, tick-borne disease, is actually more related to malaria. It's a protozoan parasite. It takes different treatment to treat it. And so it's really important that if you're getting tested for Lyme disease because you have symptoms, and I'm going to talk about the symptoms of these first three next, they look very similar, unfortunately. And they're all transmitted by the same tick, unfortunately. So if you're getting tested for Lyme disease, you should also be getting tested for babesiosis, and you should also be getting tested for anaplasmosis, especially babesiosis though, because it takes different treatment. So this can be a really helpful tool to potentially print and take to your doctor if you need to be evaluated for a tick-borne disease. This can be helpful. Now, alpha-gal syndrome was a footnote on that last slide, but it is not a footnote of the Martha's Vineyard experience. Alpha-gal syndrome is booming on Martha's Vineyard. And the thing is, our tools in the toolbox to track kind of how this disease, this allergy, it's not an infectious disease, an allergy, is moving through our population, we don't have the same tools because those last 8 diseases are legally reportable from a doctor to public health and from labs to public health. There's a lot of legal mechanism for how all this works. Alpha-gal syndrome is not on that list. It's an allergy. And there's actually several other Lone Star associated diseases, infectious diseases, that are not on that list either because we haven't had Lone Stars being a big problem in Massachusetts before. So Heartland virus, Bourbon virus, and Southern tick-associated rash illness, Starry, we don't even know exactly what causes Starry yet, what kind of pathogen, what's happening. And then there's other diseases in other parts of the country too that are tick-borne diseases that are not reportable in Massachusetts that are associated with other types of ticks. And as we get into the data that I'm going to show you next, a really important thing to kind of explain to you, this is wordy down here, but really at the moral of the story is public health surveillance. Part of it is to figure out like how big is the problem. And so to do that, we need to count one case, one time. A lot of us got really familiar with this during COVID, where we were all watching the ticker of how many people had COVID. And it was really important to know how many cases there were. Now, to do that, people need to be counted in one place, one time, not in multiple places, multiple times. And so people are assigned to where they live. The public health authority that investigates that disease is where that person lives. It's not necessarily where they were exposed, and not necessarily if it's person to person where they gave it to someone else. But that's just the rules of the road. And so I just want you to know that before we move on. So all the data that we are presenting today is about Dukes County residents. And it's then contextualized to our census data, which is also Dukes County residents. So that's just kind of the picture that I'm painting for you today. I also wanted to tease apart how healthcare and public health work together, how we're complementary, but we're different. So public health and epidemiology is born out of medicine. Doctors developed germ theory. They figured out, oh, these are infectious diseases. And then beyond the person in front of them, they also figured out, this disease is moving differently in different communities, between different people. Some people are not getting it. What's up with that? And so that's how public health was born, and interventions to prevent the spread of disease in communities. So healthcare is an absolutely essential part of this piece. Healthcare is who's doing the diagnosing. They're the ones who are exercising their training and their discretion and their testing to figure out what you have. And then they report it to public health. And we then take that information and figure out, okay, what are the risk factors and protective factors? What is heightening the risk of getting sick, and what is helping them not get sick? And if there is something to be done to intervene, especially like this is, again, COVID, we had a lot of real deal nuclear options deployed in COVID. stay-at-home orders, isolation and quarantine. Those are public health interventions to stop spread in emergencies. Those are nuclear options. But for tick-borne disease, thankfully, it doesn't spread from person to person. Really, what we're doing is we're collecting information about who's the most at risk. And we've found your job might put you at risk if you're working out in tick habitat. Kids who play in the woods are at risk. Gardeners and retirees who are out in their communities gardening, they're at risk. People based on their activities and their tick habitat activities become at risk. And there's a couple more places where there's analogies. For example, doctors provide advice and information to the individual patients, whereas public health provides guidance and advice to healthcare providers and the public. And doctors will monitor patient status, whereas we monitor disease trends. So that's I just wanted to tease apart that difference before we get into the data, which we will now. So this is a state product. So this is across the whole state, and thinking about emergency department visits. Emergency department visits, we can see based on kind of the types of keywords associated with those emergency department visits, that people start showing up to emergency departments saying, I have a tick bite or I've been exposed to a tick, starting in March and then kind of vamping up in April, May, June, July, and it tapers down in August and September, and then it bumps back up in October and November. So this is tick exposure. It's not necessarily tick disease, because this is where we drive the distinction. Actual disease risk is this pretty complicated combination of, are you in tick habitat? If you're not in tick habitat, you're not likely to get a tick-borne disease. Are you practicing personal protection? If you're practicing personal protection, like Patrick is every day when he's in tick habitat every day, unlikely to get disease. How infected those ticks are, and the time the tick is attached. All of that comes together to create the real deal risk of tick-borne disease. Now, when we get public health data, it's not just those factors, tick-borne disease risk. It's also the next step, because I talked to you about how doctors need to diagnose and report for us to even know about it. So the patient has to, first of all, seek healthcare. If they go undiagnosed and don't seek healthcare, there's no way for public health to know about it. And so the data doesn't know about it. The doctor then has to do proper testing and diagnosis, and then it has to get reported. So I just want you to know what goes into these numbers. When you take that into consideration, so this is the same data set. This is emergency department visits. This is for tick-borne disease. So these are visits where they actually say, I'm going to test you. You're sick, and I'm going to test you for anaplasmosis, babesiosis, Lyme disease, whatever it is. Tick-borne disease visits. You can see a pretty clear summertime spike. And this is actually something we were saying very bluntly before COVID, that flu-like symptoms in the summer could indicate tick-borne disease. Summer flu, think tick. That got really complicated because we've had COVID spikes in the summer. But here's my solution for you. If you have flu-like symptoms in the summer, you can test yourself at home for COVID. You can test yourself at home now for flu, rule out the obvious, and then you might have more ability to figure out being like, this might be a tick disease. And that summertime period is when, if we zoom in, we have not only the most species active, but remember, it's really the deer ticks that drive our biggest diseases. It's really that these guys are active, the teenagers. They've bitten something once, they've picked up an infection, they're still small. They're small, and this is also, these are all the life stages that potentially can have diseases, but this is when we are unprotected. This is when we are behaving like, and putting ourselves at tick risk. So we're wearing shorts and flip-flops, we're hiking, we're gardening, we're out and about in the outdoors. Unfortunately, that is the same time that the ticks are. And so that really is one of the main drivers of tick-borne disease. And so that's why I spent the first part of this conversation really talking about how to protect yourself. So looking at the data, this is the most recent information. So this is in the 2 years, 2022 to 2023, looking at just our residents. So sorry, summer folks, and sorry, tourists, but this is the data that we have access to. This is how it's reported. This is our residents, and then it's divided by our residents. So Lyme disease is still king. Lyme disease is still the biggest burden on Martha's Vineyard, followed by very steep drop off, but then it is babesiosis and anaplasmosis. And the purple indicates deer tick diseases. Green is for Rocky Mountain spotted fever, which is a dog tick disease. Ehrlichiosis is dark blue, which is a Lone Star disease. Tularemia is not just a tick disease. It can be deer flies, it can be ticks, it can be contaminated water, it can be aerosolized and inhaled. And then we have not had a Powassan or a Borrelia miyamotoi case in those 2 years that I'm talking about in this graphic. So you can kind of see that same hierarchy that I was talking about. Lyme is still the biggest burden. So on Lyme disease, let's talk about Lyme. Look at this map and see where the darkest color is. I am doing this call right now from there, from Chilmark. It is where we see the most burden of Lyme disease, and really both islands have really, really, really high rates. Look at this legend. Look at what we're talking about. These numbers are huge. These numbers are huge. And even the white towns, just because they had to pick a grayscale, don't be fooled in thinking that this is low. There's states that don't come near this number of cases. Before COVID, Lyme disease was the single most common reported disease in Massachusetts, period. Lyme disease burden is immense in Massachusetts, but it's especially immense here. So how do we know and how do we look for Lyme disease? Symptoms of early infection, when you first develop the infection, show either 3 days after getting bit to 30 days. It's kind of a long time period to be watching for symptoms. And so we tell people, if you've gotten bitten by a tick, you need to basically be on alert for the next month. It's a long time. In that time, you might, if you get infected, get fever, chills, malaise is feeling icky, fatigue is feeling tired, joint, body, or headaches. Those are some of the standout symptoms. Some people really have acute joint aches, and that's kind of indicative of Lyme. Swollen lymph nodes, that's kind of a common symptom of any infection, so that's a little bit hard to tease apart. And rash, and I'm going to talk about rash in the next slide. Super important, though, to talk about. You really need to get assessed quickly, and you really need to get treatment, because untreated or unnoticed early Lyme progresses to disseminated disease for 60% of patients. And that's when the symptoms get really different, really crazy, potentially really crazy, and then they can become out harder to treat with diverse clinical manifestations. So really early treatment is really important. Here's a map of where Lyme disease is, and you can see like the whole Northeast is covered in it. And again, Minnesota and Wisconsin, cold winter states, they still have a lot of Lyme disease. You might see that Massachusetts is gray though. Why does it look like we have no Lyme disease? I promise you, it's actually the other problem. We have so much Lyme disease that Massachusetts was the first one of all of these states to say, we can't individually confirm the symptoms for every single one of these cases, because that's what CDC was going by. Public health had to verify the symptoms and the testing for every single case of Lyme for it to count. And Massachusetts, it is solid purple. And it was like, we cannot do this. We cannot keep up with this. This is not a reasonable use of public health resources. And all the other states agreed. And so now these high incidence states, places that have a lot of Lyme, we actually only do lab surveillance. We don't verify symptoms. These other states that don't have a lot of Lyme disease, and so they can investigate it and they want to know if Lyme disease shows up in their communities, they investigate that level. But these states, no. So just wanted to make that clear. Lyme disease rashes vary immensely. Here on the top left is the bullseye rash. And I hope it shows up well on your screen, but you can see this clear red ring and a clear skin in the middle. This is a classic EM or an erythema migrans rash, bullseye rash, just know the term. And this is a circular red rash that actually expands slowly and clears in the middle. So something you can do if you have a rash is to draw a border with a ballpoint pen or a marker around your rash and see if it expands over time. See what it does. But that helps you kind of know. The other reason that we talked about tick checks earlier, we talked about why you really want to check all the time, is because you want to be able to see if you have a rash. If you find the bullseye rash, we actually kind of consider you lucky because it's pretty clear what you have. That's Lyme disease, if it looks like that. But 20 to 30% of people don't get a rash at all. And the people who do get rashes, they don't all look like bullseyes all the time. And so they can look like solid lesions where we've got a lesion in the middle. They can look purple and blue. They can look different ways, and they're still Lyme rashes. But this is the classic bullseye. That is, document it, take a picture of it, send it to your doctor, start the medication with their, of course, sign off. But that is classic Lyme disease. Now, there is folks that do have a reaction to a tick bite. Before I wore permethrin treated clothing, I did get a couple tick bites. And this is the kind of reaction that I got, where I can feel the itch and then find the tick. And that is not a Lyme disease rash, just to be clear. That's just a reaction to a bite. So thinking about when Lyme disease shows up, once again, it's a summertime thing, but it also doesn't go away in the winter. Remember, those adult deer ticks are still active throughout the winter and high risk for having Lyme disease, but really summertime. So again, flu-like symptoms in the summer could indicate a tick-borne disease. But don't forget about the shoulder season. Those adult deer ticks are out and they can have infectious diseases. Lyme disease is the only disease that you can potentially take medication after finding the tick biting you and take medication right then and there to prevent getting sick in the first place. It's the only one. Does not work on babesiosis, does not work on anaplasmosis, does not work on Rocky Mountain spotted fever, only on Lyme disease. So knowing that, there's a couple criteria to work your way through about whether this is appropriate for you. So first of all, you want to be reasonably suspicious that a deer tick bite is risky for Lyme disease. And so the local rate of infection being 20% or higher is criteria number one. That criteria is absolutely met on Martha's Vineyard. For the teenage deer ticks, it's about 20%. For the adult deer ticks, it's about 40%. It doubles down. 2 blood meals, remember? Number 2, do not take medications you're not supposed to take. So if you're not allowed to take these antibiotics, don't take them. So just number 2. 3, you want to remember how we were talking about earlier about how certain ticks, certain diseases? Well, you want to be reasonably sure that the tick that you found on you is a nymph or adult deer tick. And I'm going to give you a resource for that in just a second. Most people are very bad at identifying ticks. It's hard to do, but I'm going to give you some resources. And then number 4 is that the tick has been attached for at least 24 to 36 hours. It's been there for a while. It's been feeding. 36 hours is in the guidance. You can certainly talk to your doctor about 24 hours. And again, figuring out how long it's been there is a bit tough. But if you're practicing your tick checks every day, you know that they haven't been there for 24 hours. And so you're mitigating your Lyme disease risk. Okay. That's another reason why we're doing that every day. And number 5 is that you actually have to start taking those medications as soon as possible. We're talking about taking it within 72 hours of the time the tick is removed. Now, remember, summertime, peak tick disease risk. Do you want to be trying to talk to your doctor and get to the pharmacy in August? Probably not. So talk to your doctor ahead of time about whether this is appropriate for you. You want to have this available to you if you need it, and you don't want to have to call someone and then get in line at the pharmacy to get it when you don't have the clock counting down over your head. So it doesn't take much for them to start kind of swelling up. So unfed, this is a female adult black-legged deer tick, and this is them growing over after feeding. And so if they start looking like they're bulging, they've been there too long. If they start looking discolored, they've been there too long. If they start looking kind of textured, they might have been there too long. You want to catch them here. When they're hard, they're flat, and they're hard to squish. That's when you want to catch them. Now, to know what tick bit you, or just to know what tick this is, it doesn't have to bite you for you to take a picture of it. You can take a picture and you can send it in to tick spotters. If you Google tick spotters, but these resources, this link down here, they will be in the slides sent around later to everyone. But tick spotters is a free resource. You can send in a picture. They can actually guesstimate how long that tick has been feeding based on what it looks like. You got to be able to take a good picture, and they've got tips on how to do that on their website. So don't destroy it right away. Figure out what you need to do, and then potentially take a picture to know what you need, what you have. All right, moving on to the next one. This is the second biggie in Massachusetts, all of Massachusetts, but also Martha's Vineyard. Babesiosis. Babesiosis is that protozoan parasite infection that's more like malaria than it is like Lyme disease. And the symptoms also can take a long time. They can take up to a month to show up. The symptoms look kind of similar too. We're talking about fever, chills, feeling icky, malaise, fatigue, joint, body, and headaches. Those are the same symptoms that Lyme disease started with. Couple new ones: loss of appetite, nausea. This one's a biggie: dark urine. This is an emergency department symptom. If you have dark urine and you've had these kinds of symptoms, you need to go to the ER. Less common, we're talking about dry throat, dry cough, sore throat, and light sensitivity. And then some people don't even get sick at all. And so 25% of adults and 50% of kids just don't get sick at all from babesiosis. People at higher risk, though, for getting really sick with babesiosis, because babesiosis has killed people on Martha's Vineyard. Sorry to be kind of, I'm not a fearmonger, it's true. There have been people that have died. Folks who are older, who have a spleen condition, who have impaired immune function, and also people who have multiple tick-borne diseases at once. Remember, Lyme disease, babesiosis, and anaplasmosis are all deer tick diseases. There is the possibility that the tick that bites you has multiple diseases. There's also the possibility that you got bitten by multiple ticks. And so having multiple tick-borne diseases at the same time is problematic. Your body's going to have a hard time fighting that off. And unfortunately, the map, we are again the hot spot. So Martha's Vineyard and Nantucket, Lower Cape, Outer Cape, New Bedford, and Fall River all are hot spots for babesiosis. And once again, it shows up in the summertime. That's when those nymph teenage deer ticks are active. When we are walking around unprotected, that's when they're biting, and that's when the disease is happening. And the last infectious disease I'm going to talk about today, this is anaplasmosis. Anaplasmosis has a little bit quicker of a time frame. Again, this is a bacterial infection, back to bacteria, shows up within 2 weeks, but it has a lot of the same symptoms again: fever, chills, rigors, malaise, headache. New symptoms are nausea, vomiting, diarrhea, and loss of appetite, and some rash. Same people are kind of at the high risk category: folks who are older, who have impaired immune function, and a delay in diagnosis and treatment is not good for this condition, and having multiple tick-borne diseases is not good for this condition, and it can be critical. For once, we are not number one on the map. For once, it actually is Western Massachusetts, our colleagues in Western Massachusetts, but we are still hotspots. We are still hotspots for anaplasmosis. Okay, that was a lot of information. I'm hoping folks are still with me. I see 16 participants. Thank you. We're entering a new chapter. So quickly, gonna take a little sip of water. And we'll get ready to talk about this one. So this is the new kid on the block, the red meat allergy, or alpha-gal syndrome. It is caused by a tick bite. An allergy caused by a tick bite is weird. It's novel. We haven't seen it before, but here we are. And it's caused by lone star ticks in the United States. And actually, it's caused by other types of ticks in other places in the world. But lone star ticks are the problem in the United States. So what is alpha-gal? Alpha-gal is not referring to me. Alpha-gal is referring to a sugar. Alpha-gal stands for, if I'm going to say it right, galactose alpha 1,3 galactose. It's a molecule. It is present in tissues and cells of all non-primate mammals. So your cat, your dog, your horse, all non-primate mammals, including the ones you actually eat. So cows, sheep, lamb, deer, venison, pork, rabbit, but also mice. And no, we're not eating mice, but they're used pretty heavily in a lot of pharmaceutical development. And the molecule is present in a lot of pharmaceuticals. And so it's also present in some other organisms too, and we'll get there. And syndrome refers to a collection of symptoms. And this is actually kind of one of the frustrating parts of alpha-gal syndrome that we're going to get to. Is one of the things about its syndrome is it's consistently inconsistent. That's one of the hallmark symptoms. So, preface, kind of beating myself to my own punch here, but we're talking about a paradigm shifting allergy. So let's talk about what the paradigm was. Conventional food allergies, you probably know someone who's had it. A peanut allergy, a shellfish allergy. If you've been around folks that have food allergies, you might have seen them live and in the flesh or talked to them about it. Usually folks know when they've eaten a contaminated food with food allergies. They have reactions within 1 to 2 hours. A lot of folks develop their food allergy in childhood. And usually the way that the allergy happens is that they eat a food once, and then their immune system recognizes it as foreign, develops antibodies, and then they actually react the second time that they eat the food. The food allergen is usually a protein, and it is fairly consistent symptoms when that person eats their trigger food. They kind of know what's happening when they have a reaction. They're like, I just got glutened. I've heard someone say that. Or there's shellfish in there. There's a shrimp in there. I know it, because they know there's symptoms. Now, alpha-gal syndrome. Alpha-gal syndrome can be immediate, but most often it's not. It's often delayed 2 to 10 hours. And actually, we often call it the midnight allergy because people actually eat their largest meal of alpha-gal containing food. So a steak, a hamburger, ice cream at dinner. And so then they wake up in the middle of the night with symptoms. And it is very discombobulating. It is very hard when you have symptoms that are so delayed to figure out what caused it. And so it's very frustrating for patients and providers to put 2 and 2 together. The onset also happens usually after consuming mammalian products safely for many years. This is like all of a sudden new. And the primary way that people get it is from a tick bite, which is totally different, totally new. Lone Stars in the United States. The allergen itself is a carbohydrate, and it actually doesn't cook out. It doesn't denature like proteins might. And diverse symptom presentations for alpha-gal syndrome, it's actually one of its hallmark symptoms is it's consistently inconsistent. And that's pretty wild and very frustrating. So here are some of those symptoms that can happen. So first, we're talking about some skin symptoms. So here's hives. This is a gentleman who ate pork sausage with his allergist to see how the symptoms were working. And at 6 hours, you can start to see some redness forming. 7 hours, you can see a lot more redness. 8 hours and greater, you see the raised bump in the hives. Really delayed. And this is from Dr. Scott Cummins, who actually will be speaking at the Vineyard Haven Library virtually in a date coming up to be determined. So keep your eyes peeled for a presentation from the alpha-gal expert coming to you soon. There's also swelling, and we're talking about palms and the soles of feet. They'll flush and swell up. Some people only get gastrointestinal symptoms, and so a lot of folks who've had those symptoms for a long time have been chronically misdiagnosed, not knowing, and their provider not knowing that it was alpha-gal. And when they remove red mammalian meat and mammalian products from their diet, their symptoms go away. So abdominal pain, cramping, nausea, vomiting, diarrhea, and heartburn. And no other symptoms, just that, which is very odd. And then there's the more severe symptoms, and these are really can get very scary. Anaphylaxis, that is life-threatening. That is an EpiPen, that is emergency departments. That needs to be dealt with immediately. People can die from anaphylaxis. Cardiovascular symptoms that might not rise to the level of anaphylaxis include low blood pressure, lightheadedness, dizziness, a weak and rapid pulse, feeling like you will faint, fainting, or shock. And then respiratory symptoms like shortness of breath, wheezing, chest tightness, cough, hoarseness, difficulty breathing, or other respiratory symptoms. And really the super frustrating part about alpha-gal syndrome for patients, providers, for everyone is that reactions do not occur after every exposure or follow an obvious pattern. And that is one of the hallmark symptoms, is consistent inconsistency. Trigger foods can be really diverse. By definition, people with alpha-gal syndrome react to some sort of red meat, by definition. So 100% of people with alpha-gal syndrome react to mammalian meat. Now, there's other types of products that potentially can contain alpha-gal, including one Japanese study found flounder roe contained alpha-gal. And 75% of people who also reacted to red meat, also reacted to flounder roe. Dairy, there's less alpha-gal content in dairy than there is in just straight red meat, but 10 to 33%. The science is still forming on this. It was only actually figured out as an distinct allergy in 2009. So there's still a lot of science to be figured out. Alpha-gal gelatin is a mammalian product, and some people react to gelatin. Carrageenan is an algae derivative, so that's kind of different, and that can also be in foods, and people can react to that. And then there's a lot of unknowns for trigger foods, still figuring it out, because, and here's kind of some more pictures, but just at the bottom to draw your attention, there is currently no federal regulatory requirements for the labeling of foods, medications, or products with mammalian content. There's no requirements. The term vegan is not regulated either. The term vegan certified is safer, but there are people with alpha-gal syndrome that have actually reacted to even vegan certified foods. And really folks are DIYing what's safe and what's not safe. If you have alpha-gal syndrome, or you have someone in your life who has alpha-gal syndrome, Martha's Vineyard actually now has an alpha-gal support group led by Amelia Hambrecht. You can absolutely join those support groups at any point where folks are talking to each other about what's safe and what's not safe. Highly sensitive folks, not everyone has the same sensitivity and reactivity, but the highly sensitive folks have a really hard time because also cross-contamination can be a problem. There's even folks who react to the smell, the aerosolization of cooking meat. There's people who react to that. There's people who react to gelatin and capsules and medications. Leather, people will literally react to the touch of leather. There's an untold number of mammalian products and beauty products. They don't have to label them. It's a different regulatory system. Beauty products can be very scary. And even medications, medications are often, like a lot of medications, I won't say the majority by any stretch, but like animal models is a lot of how we've developed modern medicine. And so there are different types of medications that are, for the highly sensitive, dangerous and can cause allergic reactions. So there's still a lot to be figured out. But when we're kind of trying to wrap our brains around how big the problem on Martha's Vineyard is, the information that we've been able to gather hasn't been our traditional kind of provider diagnosis, provider reports, individual cases. But instead, we can, of course, ask our healthcare partners, how many patients do you have? How many patients do you have that you have diagnosed with alpha-gal syndrome? So we asked one allergist, and really this is the main allergist on Martha's Vineyard. There is telehealth allergists, and there's people who go to allergists off island. So this is not actually this is the minimum. One allergist on Martha's Vineyard currently has 250 patients actively being managed for alpha-gal syndrome. And this map shows not people, but ticks. This map shows Lone Star ticks, and they're found in everywhere on island, all 6 towns. They started in the edges, they made their way in, and they're now found everywhere on island. So if alpha-gal, if we're talking about 250 patients in one provider's office, that puts it already at number 2, the second most common tick condition on Martha's Vineyard, just to put it in context. And maybe it'll surpass Lyme, which would not be great. Now, alpha-gal is not a Martha's Vineyard exclusive problem. It is hitting us like a truck, but it is not just an only Martha's Vineyard problem. So just to set the scene, Lone Star ticks are found in a pretty wide territory. So, and that population and distribution of Lone Star ticks has fluctuated over time. So in the light orange is where they were historically back in there about 100 years ago, or more than 100 years ago in 1912. And then it retracted to the black line, and that's in 1945. And then it expanded again to the larger orange group in 2022. So absolutely, do climate has to do with it? Yes, of course it does. Climate change and the habitat being hospitable to Lone Star ticks has a component to play. Another resource to kind of see where alpha-gal is in the United States is self-reports. This website down here, alphagalinformation.org, is a wonderful website. Wonderful website, evidence-based, lots of rich detail. People are dropping pins of where they live, and you can clearly see this same trend is going to show up in the next few maps too, that these southeastern states, they're getting hammered, and especially also up the coast, getting hammered with alpha-gal. And not that it's not showing up in other places, but probably these people might have traveled, I would hazard a guess, because Lone Stars are not found out in these areas. Zooming in, our friends in the Hamptons, a lot of people with alpha-gal in Hamptons, and actually allergist from the Hamptons, Dr. Erin McGinty, presented here on Martha's Vineyard in April of 2023 to both our public and our providers. At the invitation actually of Patrick. Patrick facilitated that to kind of share what our future could look like, because the Hamptons has already been hit hard. And lo and behold, we're getting hit hard too. That presentation is recorded and on our website if you would like to watch it from an allergist. And there are cases on Nantucket and there are cases on Cape Cod. So this is the map. We can look at another source of data, and that's labs. We could look at labs, and this is the CDC's effort. There was one main lab doing most of the alpha-gal testing in the entire United States, so it actually made for a very doable study. And so once again, you can see these states getting hammered hard with alpha-gal syndrome, but you can also see going up the coast, darker colors too. And if you zoom in, these are light, not quite full dark blue, but lighter blue. Martha's Vineyard, Nantucket, Cape Cod, the Hamptons is dark. And so this is kind of what the US distribution so far looks like from what we have. And so thinking about this and how important it is to be even aware of alpha-gal syndrome, because the symptoms are often so delayed. So figuring out whether or not you have alpha-gal is important. Pretty much every clinician will tell you if you don't have symptoms, it's not necessary to test. It really is a symptom dependent. If you have symptoms and you want to, and you think it might be alpha-gal, yes. But just testing for the sake of testing, that's not indicative of allergy. But if you do have an allergy, the next step is to be referred to an allergist. And that, when you're working with that allergist, you might need to figure out exactly which things you're reacting to. Each person is different. And so that might require diet and lifestyle changes, depending on your triggers. There is no treatment to date for it, but here's actually some hope. And the kicker is that some patients find that the allergy goes away after a period of time, if they do not get more tick bites. So with alpha-gal, prevention is the cure, which is kind of, it doesn't happen for anything else. It's pretty crazy, but prevention is the cure. So here is a visual of one patient's labs over time. So the blue is their total immune globulin, and the orange is their alpha-gal specific immune globulin. Both are at this flat level over time until a person is bitten. This person was bitten by 50 larval ticks on September 4th. And they don't have an immune response right away. That's kind of classic immune, like it takes a while. But 2 weeks later, the immune response ramps right up, and probably the clinical symptoms too. So larval Lone Star ticks and just ticks in general, tick bites in general, can send people into more severe symptoms or trigger regression in their symptoms or prolong their symptoms. So avoiding tick bites is everything. And about that, remember, tick bite risk is year-round, but it is highest in spring to fall. Disease risk is year-round, highest in spring to fall. Allergy risk is in spring to fall. That's when those ticks are active. Spring to fall, but really, tick bite is a year-round activity. We live in tick country. So absolutely critical is preventing the bite. Absolutely critical. So to rehash, we're talking about #1 prevention tool, permethrin-treated clothing, dressing ticks smart, wearing effective repellents, lint rollers, tape, and tweezers. Have your tick kit. Have it on you at all times. Remove or dry your clothes upon coming home to get the clingers on off. Daily tick checks. Save your tick. Take a photo of it, send it into tick spotters, figure out what type of tick it is. And this is one that I didn't get to touch on, ran out of time, but tick report, you can send in your tick to get it tested. If you've been bitten, for $50, you can get your tick tested to figure out what your risk is from that tick. That's not saying you weren't bit by another tick too. So again, ticks are evolutionarily designed to be sneaky. So make sure that you're practicing all your prevention tools and so that you stay tick safe. And we have a discount code. Please use it. We just did it to make it easier for people to purchase permethrin treated clothing. And I thank you for your time. It's been a long conversation and I really appreciate you sticking with me. Thank you.
I'll jump in and say there were no questions that popped up in the chat during the talk, but good job.
Yes, thank you, Patrick. I really appreciate you monitoring that. Is there any questions that I can answer while the folks who are still on with us have questions? And Patrick, can you go ahead and drop both your email and my email in the chat? I didn't have a slide on that to end, but if folks want to email us questions after the fact, please feel free at any time. And maybe also your really website, I think would also be good to put in the chat. And we'll send these resources around afterwards. Liz has folks' emails for those who registered.
Any questions? It's a
Thank you,
very
Mary.
thorough presentation.
It's a lot, and thank you so much for sticking with me. I mean, we really did only do 3 out of the 8 infectious diseases. There's a lot. And then there's the allergy. And so, I mean, I've learned it is an incredibly complicated topic, is what I've learned.
Mm. Okay, so if we don't have any questions, as you said, I will be sending the a PDF of your presentation, of Leah's presentation to everybody, so you'll have that. And you can see the email addresses there in the chat. Oh, here is a question actually. Does the number on the test result mean anything?
That's a really great question, Marion, and I think we are still figuring that out. Certainly, and actually really Scott Cummins, who's going to be presenting, and please do attend his presentation. He's the alpha-gal expert, and he's the one who's been reading these labs for over a decade. And so that's a very good question for him. But there are certainly people, Aaron McGinty, who presented over a year ago, really talked about the ratio being more meaningful than the straight alpha-gal result. So there's people who are just allergic to a lot of things. And so knowing what your total IgE compared to your alpha-gal specific IgE, she's seen be more indicative of your allergy level, as opposed to the straight, oh, this is a high level for your alpha-gal specific antibody. So that's me recapping what I've learned from allergists, but I'm still learning too.
Lots of people commenting saying it was very informative and excellent presentation. Thank you so much, Leah.
Thank you for having me. I much appreciate everyone's time, and thank you, Vineyard Haven Library, for hosting.
You're welcome. And again, we'll be sending out all the information and a link to this recording of this presentation, and also information about that upcoming talk with the alpha-gal specialist, Scott Cummins, is it? Is that right?
You got it.
As soon as we get the time and date all sorted out, we will send that out to you.
Thank you all, and looking forward to seeing you there.
Thank you. Bye, everyone.